Anyways, AJ, what are we covering today, my man?
What up, cuz?
Let's see, bro. Nice, I
I
like
think
that.
the last one was louder, but it's okay.
It's all good.
That's
We can do better
all
next time.
Yeah, we'll do better.
What are we doing today?
We are talking about the most common sport injuries.
It's a good time to do it. We get a lot of questions on this.
We do, and it is.
I
it
feel
is
like I say that about
common.
every topic, though, right?
You do say that every time.
just
but
noticed
you also
that.
have to take into consideration that you're a doctor. You get
Yeah.
everything, especially
Yeah,
as
that's a good point.
Sports medicine, geriatrics, family medicine. We get tons of questions about everything.
Good point.
You know, so yeah, we do. And I think what we need to do today is discuss maybe the top 10 most common injuries. And a lot of these are not in order, but we should discuss the most common, what to do and how to prevent them.
Okay.
You know, if you want, I could start out with like the first one. One that's very common is a groin injury, like a groin strain.
The groin is like...
Oh yeah, it is painful as hell. It's it's made up of the inner thigh muscles called the adductors. And if it's strained, you'll typically get like a shooting pain kind of down.
The worst pain. Oh my God.
It is, yeah. So it's a strain. So you'll get the shooting pain down your leg, which is pretty scary. But a lot of time to prevent these injuries is stretching, right? Stretch.
And proper stretching.
Yeah, exactly.
I feel like
you can't
people
stretch
that,
for like 2
when you're
minutes and just
stretching,
and that's it.
like proper stretching so that you don't pull your groin
Exactly.
and pull that muscle and then you actually end up injuring it.
Yep.
But if you do anti-inflammatories,
Yep. Rest.
Yep. Rice, right? Rest,
Yep.
ice, compression,
And
elevation.
elevation, for sure.
And when we say compression, guys, we're just talking about wrapping it, right?
Yep.
So
Yep.
it's kind of hard to wrap the groin, but
yeah, but it's
we're
just
talking about
rested,
any other.
rested at least, because they don't all qualify for everything. But in general, that's the best kind. Rice is the best thing.
100%.
Sure.
Next one is fracture. So a fracture or broken bone, it's usually stress caused by continuous pressure on the bone.
Yeah.
So, like boxers, they're always fracturing the nose. The majority of the fractures are usually happening in the legs and feet.
Yeah.
Right?
Yeah.
So how many people you have stress fractures for
Exactly.
runners and ankles? Oh my God.
Oh yeah,
ankles
or there's
all
like
the
dull,
time.
the dull pain, right? A lot of them are like runners or a lot of these athletes, not necessarily falling or getting, some sort of trauma. A lot of them is just overuse and just too much tension on that bone, long periods. So these stress fractures are, they
especially
might
marathon runners. They're the ones who get stress fractures.
Exactly.
And the thing, the difference between, so one of the most common questions people ask, like, hey, I injured my ankle. What do I do next?
Yeah.
Right. So like if you injured it and you cannot walk on it and the swelling is on there, first of all, even if you got an x-ray right away, sometimes it doesn't show it from the swelling, right?
I agree.
But if you do, you need to be able to differentiate when it's a strain versus a fracture, which is what medical professionals like us can help them with.
Exactly.
But again, that goes back to the same thing. When you do, always wrap it, ice it, elevate it, and do compression.
For
so
sure.
It's a must with that anyways.
They
Make
do,
sure you
but
know.
like not every, like there's certain criteria before we jump into always x-rays because the treatment outcome is going to be the same. So versus a strain or an actual fracture. But if you're able to typically walk on it, you typically don't need imaging at that point. But if with time also, like you said, fractures don't really always show initially. It might show afterwards, after a couple days or after a couple weeks.
Yep.
So, and that's what it is. But yeah. So our next one is concussions.
Okay.
That's the forefront of so many debates. And there's a lot of the leagues, whether football, basketball, baseball, they do have a concussion protocol that they have to abide by because it is pretty dangerous. And it can lead to CTE, which is chronic traumatic encephalopathy, with if you get multiple concussions. Nausea, loss of balance, headaches, amnesia, difficulty concentrating on things.
And amnesia can go away, obviously. But you got to think about it like this. When you are hit, your brain is swollen.
Yep.
Right. And when that swelling is happening, if you get hit again, is when it's the problem.
Yeah,
that's why
there's a protocol.
like this CTE, they take it serious because if you had a concussion on the field while you're playing football, if that doctor releases you and you go back on the field again, that could change your life.
Fact.
So that's why people need to understand in boxing and football, when doctors like us are making a decision for you to go back in or not, we're not thinking about winning the fight. We're thinking about long term.
For sure.
I've seen so many boxing matches and UFC matches where they stop the fight. And everyone's like, why? It's like, dude, but you're not thinking about what's going to happen to that dude who keeps getting pounded
in his face.
his head. That's not going to help.
100% agree with you. That's why it's dangerous, and that's why you need to follow
protect
the protocols,
our kids, man, especially
imaging,
with the young brains, man.
God. Well, that's why the Guardian caps.
Guardian caps.
Yeah. Make sure you look out for that. We like our previous episode with Reagan Weiss when we talked about the Guardian caps, how important that is. So we need to.
We'll get you guys more info on that.
Definitely.
But while we're talking about injuries, I did talk about like fractures, lateral ankle sprains.
Mm-hmm. So common.
I feel like one of the most important thing is when you sprain your ankle, right? You start feeling better 3-4 weeks down the line, and you're like, I don't need an ankle brace.
Yeah.
You're walking one little twist, and you start right back from square one. and you got to do the whole thing again. So if you had an ankle sprain, make sure you're wearing an ankle brace.
I agree.
Because you want to stabilize it. So if you have inflammation in your ankle and you continue to do this,
you're irritating it.
You're not going to, the inflammation is not going to go away.
It's not going to subside.
So you got to make sure that, it's very common in sports, dancing, jumping, twisting, all of that.
Yeah, and take it from me, I had a lateral ankle sprain that was pretty bad, and honestly, I still get pain in my ankle from time to time. The reason behind it is because I went back into physical activity real quick.
Right away, without wearing an ankle brace.
I didn't wear my ankle brace. I felt a little bit better, and I kept on doing it. Now I'm suffering, with times, and even when it's cold, I feel it when it's cold. But yeah, you're right. Another one that's very common, and I think this is one of your favorite because you've seen so many of them, is ACL tears.
Oh, man. Yeah.
Yeah. ACL tears. Basically, the ACL is the anterior cruciate ligament. It connects the leg bone to the knee. This is a very, very common injury, and it typically happens from like colliding from the side or abruptly changing positions when you're running or even when you're walking as well. But it also takes a lot of time under the knife. And it takes a few months to recover. Yeah. The best advice I'll give you is physical therapy, recovery, strengthening.
Most important.
Afterwards is more important than the actual surgery to me, to be honest
and
with you.
Because
weight. Weight loss is, for sure. And that's what, but typically a lot of these people are athletes and they're like kind of in good shape already. But skiing, for example, I'm terrified to go skiing. I'm terrified to go snowboarding or skiing.
You know how many friends went and came back with the ACL?
I know.
It's ridiculous. Changes your life.
It does.
Unless you're Adrian Peterson.
Yeah,
I think he was back on the field like 6 months.
Yeah, but see, he's got the best trainers, best doctors. I mean, he's got tons of physical therapists. And
most people that do tear their ACL, AJ, what ends up happening is they go back too soon and then they tear their meniscus. Then they tear their PCL. Then they tear their MCL. Yeah. And so like that one thing is a domino effect. If you don't fully hear that ACL and get that tendon back on track, then that ligament on track, then you're going to injure the next ligament, right?
For sure.
Okay, so the next one, joint dislocation.
Yeah.
I think this is pretty cool because I just watched a video of Kobe Bryant.
Yeah.
He was in the middle of his game and his finger went out of socket and the doctor popped it back in place and he went back and played.
That's pretty
But
crazy.
the most common thing for joint dislocation is obviously the shoulder.
Yeah, for sure.
How many people tell you, man, I popped my shoulder back into place?
Yeah. God, that's gotta be painful. I've never had a shoulder dislocation. Have you had one?
I had finger and shoulder.
Oh,
but the craziest thing about it is when it happened to me, when they put it back in place, it went back to normal.
Really? How long?
I didn't even have pain.
You didn't have pain afterwards at all?
I had a lot of pain when it was dislocated, but then when I popped it back into place, for some reason I wasn't in pain. But also I was like, had adrenaline rush. I was in the middle of a game, so it was maybe a little bit different. But I literally popped it. I told you, Kobe Bryant, they popped his finger back and he went back and played.
That's crazy.
God knows how many points he scored after that.
Shin splint. That's a pretty common one also, which is a shooting pain down the front of your leg.
Fufu was just complaining about that right now.
So
just
common in athletes.
And I'm like, what
runners.
are you doing? He's like, I'm doing leg press. I'm like,
wow.
So you're complaining to me about pain
about your
in your shins, and you're doing leg press.
Yeah, great job, buddy.
Yeah, smart.
No, so it happens in runners typically or athletes, and you'd be surprised that it happens in a lot of people who don't engage in physical activity. Because of maybe muscle mass and weakness. So you might just need to change your shoes also. They recommend you might need some better shoes or better inserts.
Vitamin D, I heard, also helps too.
Yeah.
Vitamin D, wrapping it, icing it 3 to 4 times a day.
Yep.
And then anti-inflammatories. But again, if you have stomach ulcers, you have a chance of bleeding, or you're on blood thinners, do not take anti-inflammatories. Just letting you know now. But anti-inflammatories is good for this if you don't have a reason not to take it.
For sure. And I always think that anytime you are considering taking any medication, you have to speak with your doctor.
100%.
This is something that we're talking in general. So not every single person qualifies. Tylenol, for example, or anti-inflammatory. Well, Tylenol is not the best anti-inflammatory.
The next one is probably one of the most common complaints I ever get in my office. Most common complaints we get in the ER. What do you think it is?
Lower back pain.
Lower back pain, man.
For sure.
Lower back pain. The problem with lower back pain is figuring out where the problem. If you look at the anatomy of the back, it's crazy.
Yeah.
How many nerves? How many discs? You got your cervical, thoracic, lumbar, sacral, all the way down. And the most common place they do have it is in the lumbar, right?
Yeah. L4, L5 typically.
Exactly. And you got to know. And one thing that I always tell is that if you're at Walmart or in the grocery store and you see those older ladies or older gentlemen leaning forward, that's spinal stenosis, right?
Yeah.
Because if your spine is narrow and you bend forward, you open up the spine and it relieves your pain. That's how I know when people have spinal stenosis.
For sure.
But you can also have spasm. You can have bulging disc, sciatica. Sciatica is the most common thing that people always talk about. And people don't understand that once that sciatic nerve is compressed, you have to release it with therapy, with whatever it is that you have to do to release it. Unless it's released, you're still going to have that pain shooting down your leg.
Yeah, for sure. I think we got, one more. pulled muscle.
Yes.
Which one's the most common? Do you think the most common pulled muscle?
Hamstring?
Yes.
Yeah, because I always pull my hamstring. That's why.
Good job.
Yeah.
Typically, it's very rigid.
Yeah.
So how do you avoid it? Stretch.
Yeah, stretch properly. Yeah.
Stretch.
There's so many case studies that say don't stretch. I say it's like warming up your car.
Yeah.
Like warm up, stretch so that you don't get
You'll
the
perform
injuries.
better.
100%.
And I think you'll reduce injuries. I don't care what anybody says.
100%.
Yeah, for sure. So that is the 10 most common injuries. I mean, we talked about it. Groin strains, fractures or broken bone, shin splints, concussions, ACL tears, patellofemoral pain syndrome, lower back pain, pulled muscle, joint dislocations, and lateral ankle sprains.
Awesome.
They're pretty common. Still talk to your doctor if you suffer from any of these, and if you have questions. You're also more than welcome to ask us and text us or send us a message, and we'll be more than happy to.
Well, we're gonna get an
right
orthopedic
direction.
doctor too. We'll get Dr. Moynihan on, and we'll discuss a lot.
I think it's a good idea. We've got to talk to Daniel. He's a fantastic orthopedic surgeon.
Yeah. So we'll get Daniel on.
Yes,
That'll be
perfect.
great.
Awesome, man. Well,
Awesome.
thanks, buddy.
Thanks, man.